Senator Ruston, please, your opening remarks.
Thank you very much, Greg, and thank you very much, Mark. Well, Australia's health system has long been the envy of the world. It's a system that's grounded in the firm belief that no matter who you are or where you live, you will get access to affordable, quality health care. And at the heart of that system is Medicare. And Australians rightly are proud of Medicare, which is why it has been so disappointing to see the Prime Minister, the leader of this country, behaving like a political vulture preying on hard-working, elderly, sick and vulnerable Australians, using this as a campaign to fuel his Medicare campaign. Prime Minister, Medicare is not a plaything of yours. It belongs to the Australian people. And while the PM is out there waving his Medicare card around and trying to lie his way back to the lodge, Australians are living with the reality that our health system is under real pressure at the moment. And Australians know, because it's never been harder or more expensive to see a doctor than it is right now in this country. By almost every metric, Labor has failed Australians on healthcare. Instead of strengthening Medicare, as was promised when they went to the last election, Medicare has only been weakened. And the numbers back it up, straight from the national health accounts. Since Labor took office, bulk billing has dropped by 11%. It was 88% when this government came in, and it's now 77%. And you can't blame COVID. Prior to COVID, bulk billing rates were at 86%. And in fact, in the minister's own electorate, bulk billing rates have dropped by 12%. So across the country, Australians have seen 40 million fewer bulk billed visits to their GP last year alone. And while bulk billing is dropping, out-of-pocket costs are skyrocketing. Australians are paying the highest amount of out-of-pocket costs to see a GP than they ever have before, 45% more out of their own pockets when they see a doctor. And that's forcing 1.5 million Australians last year alone to choose not to see their GP because they said they simply could not afford it. Health has become another victim of Labor's cost of living crisis. But we have a really good story to tell on health, but the Labor Party does not, which is why it is telling you stories and resorting to lies and scare campaigns around health this election. So I just want to be absolutely clear. The Coalition rules out any cuts to Medicare. We will keep open all urgent care clinics. Under us, medicines will be cheaper. We will rule out any cuts to hospital funding, and the Coalition will never move to a US-style healthcare system. These are just Labor lies. What the Coalition will be doing, though, is we'll increase investment into Medicare, as we always have and always will. We'll prioritise workforce because we understand no policy can be achieved without the workforce to deliver it. We also won't forget the people who live in the bush because we understand the unique challenges that they face by investing and supporting the next generation of rural doctors and rural generalists. We will also back Australians to get access to affordable medicine by lowering the PBS copay to $25 because no one should be making the decision about whether they put food on the table or fill their script. We'll support women's health on a number of measures, but most importantly including making sure that we deal with the silent and nasty disease that is endometriosis that affects 1 in 9 Australian women and often robs them of a chance of ever having a family. We also remain committed to the delivery of the National Mental Health and Suicide Prevention Plan, and we will reinstate Medicare subsidised mental health sessions that were cut in half by this government against the advice of the experts. We will commit to continuing funding of the National Suicide Prevention Fund, something the government has cut. The Coalition will prioritise mental health and suicide prevention, as we will prioritise innovation and research. This is in our DNA, which was evidenced by the establishment of the Medical Research Future Fund by Peter Dutton, which has saved and changed the lives of hundreds of thousands of Australians by the research and outcomes that that particular fund has achieved. And the introduction of universal telehealth, the biggest reform to Medicare since its inception. A coalition government will deliver better outcomes for Australians, better health outcomes for Australians, because we will invest in a future-focused health system, one that sets the right priorities where everybody works together. We need coordination, not cheap political potshots. whether that be the public or the private sector, whether it be the states and the territories or the Commonwealth, whether that be doctors, nurses, allied health, hospitals or our care workers, mental health or physical health, whether you live in the country or whether you live in the bush, in the city. These are not separate challenges, they are interconnected, and so too must be our solutions. We need a system that works as a system where the left hand actually knows what the right hand is doing. This isn't about slogans or photo opportunities. It's about saving lives, putting patients first, and building a stronger and more cohesive model of care to serve all Australians. Australia does have a great health system, but because of the failures of the last 3 years, it's under real strain. It's time to stop the lies and start the work of serious reform. That means affordable care, accessible GPs, better mental health support and quality care no matter where you live. Australians deserve a government that puts their healthcare first, not politics.
And Ruston, thank you, bringing it in very much on time. So, Minister Mark Butler, over to you for roughly the situation.
Thank you, Greg, and thank you, Anne, as well. I recognise the traditional owners of the lands on which we're coming together today. Our respects to their elders past and present, and thank the National Press Club for organising this debate. I was last here in May 2023 in the lead up to the budget that year, and in that speech I outlined some of the history of Medicare and how that history informs our current challenges. I also reminded, though, the audience of the speech made by Peter Dutton here when he was the Health Minister in the lead up to the infamous 2014 budget, back to a time when Peter Dutton used to show up at the National Press Club. In that speech, Peter Dutton outlined his plan for a so-called sustainable Medicare. $50 billion ripped out of public hospitals, a tax on every visit to the GP for every man, woman, pensioner and child. And when Labor blocked that vandalism in the Senate, Peter Dutton responded by freezing the Medicare rebates for 6 long years, ripping billions of dollars out of general practice. As I said here 2 years ago, those 9 years of nasty cuts and calculated neglect have precipitated the crisis that confronts us today. Only months before that speech to the Press Club, of course, Peter Dutton had looked Australians in the eye and promised that there would be no cuts to health. Sounds very familiar today. A stronger Medicare sits right at the heart of the Albanese government's plan to build Australia's future. That's why Medicare has featured so heavily in Labor's election campaign, because for Labor, Medicare is the beating heart of Australia's enviable health system. When we came to government after a decade of those cuts, bulk billing was in freefall. Not my words, the description from the College of GPs. We've stopped and reversed that freefall by delivering the biggest investment in bulk billing in Medicare's history in the 2023 budget. And we will build on that with the $8 billion investment that delivers bulk billing support for the first time to every single Australian. At the last election, we promised 50 Medicare urgent care clinics, and we've delivered 87. And a re-elected Albanese government will deliver 50 more clinics across the country. In the 2022 election campaign, that promise was criticised by some and rejected outright by the coalition, even though pretty much every country we compare ourselves to has some sort of urgent care model. Our Medicare urgent care clinics have been a game changer for communities across the country. Over 1.3 million patients have already been seen nationwide, a third of whom are under the age of 15, taking pressure off busy hospital emergency departments. Every single visit bulk billed. We're also delivering cheaper medicines for all Australians. We slashed the maximum amount that pensioners pay for their medicines, delivering them an additional 66 million free scripts already. We delivered the largest price reduction in the 75-year history of the PBS for general patients, and we've finally introduced 60-day scripts for around 300 common medicines, meaning that millions of Australians are saving time and even more money. And a re-elected government will make medicines even cheaper. From 1st January next year, the maximum you'll pay for a script is $25, the same price it was way back in 2004. But all of this is at risk under Peter Dutton and the Liberals. When Peter Dutton was Health Minister, he looked Australians in the eye and promised that there would be no cuts to health. And then in his first budget, he cut $50 billion from public hospitals. He tried to end bulk billing altogether for GP visits, for pathology services, for imaging services, because, as he said at the time, he thought there were too many free Medicare services, echoing the views of his mentor John Howard, who described bulk billing, in his words, as a complete rort. And when he couldn't get all of that through the Parliament, Peter Dutton started the Coalition's 6-year-long freeze on Medicare rebates. It's little wonder that Australia's doctors voted Peter Dutton the worst health minister in the history of Medicare. And as Malcolm Turnbull said only 2 days ago, Peter Dutton does have form on health, and he has to wear that track record. Now, at this election, he expects Australians to believe that same promise, that there'd be no cuts to health. Well, Australians aren't mugs. Australians know that Peter Dutton needs to find $600 billion to fund his nuclear power plant. They know that when Peter Dutton says no cuts to health, he also says he will make cuts to fund that power plant, but that Australians will only find out after the election where that axe is going to fall. Peter Dutton also says the best indicator of his future action is his past performance. Well, his past performance as Health Minister was truly abysmal. That's why at this election, the choice on Medicare is just so important. It's a choice between Peter Dutton cutting Medicare again, just as he did 10 years ago, or Labor's plan to strengthen Medicare and to continue our work on delivering more doctors, more bulk billing, more urgent care clinics and cheaper medicines.
Mark Butler, thank you. A couple of questions from me, and then in due course we will have a fellow journalist joining us with their own. I'm a little reluctant to go back and re-prosecute all the arguments of the 2014 budget, but in a sense you have both taken us there in your opening remarks. So here we go. And Ruston, this came up in the Leaders' debate last night. Mark Butler says Peter Dutton has form on health. So at the heart of this is the question, is a reduction in forecast expenditure a cut? And if so, isn't that fertile ground for the government to be waging this campaign, which you dismiss as lies?
Well, look, thank you, Greg. And the reality here is that the entire campaign that the Labor Party is running at the moment on health is actually based without any truth at all. And all you have to do is to look at the facts of what actually occurred when we were in government. Bulk billing rates increased in the entire time that we were in government. We started with 82%, and when we left government, they were 88%. Throughout that time, funding to hospitals increased. Even under the time when Peter Dutton was the government, he increased hospital funding by 16%. It was 86% by the time we left government. So by every measure, I think the Coalition has a strong track record in terms of what it delivered for Australians during our 9 years as a coalition government, and that stands in very stark contrast to what the facts actually show has happened in the last 3 years. And I mean, don't ask me, don't ask Anthony Albanese, go to the Department of Health's actual website and see for yourself. The national accounts show that by every metric in the last 3 years, everything has gone backwards.
All right. Minister, is this really a standard you wish to be held to, that any variation downwards from a forecast expenditure over a 10-year, count them, 10-year horizon represents an actual cut?
Well, what Peter Dutton did was to seek to walk away from an agreement with states to partner in the operations and the funding of our public hospitals. It's in black and white in their budget papers that there would be a reduction, I say, of $50 billion. I'm actually being generous to Peter Dutton because when the government was asked in Senate estimates in 2014 what this graph meant, published by Peter Dutton at the time of the 2014 budget, they said it was actually a $57 billion reduction against the agreement that had been struck between the Commonwealth and states. Now, of course, hospital funding increased over the last decade. We've got a growing population that's getting older with more complex chronic disease, but the share paid by the Commonwealth was reducing because of this cut of $57 billion that Peter Dutton put into that 2014 budget.
All right. Let's move on to urgent care clinics, if we can. There has been a raging argument. You've both been running it over recent days about what happens to the 50 proposed new urgent care clinics that Labor has proposed. Minister, can we talk about the current ones, the ones that exist, how many have a GP in them at all opening hours?
Well, all of them except for some clinics here in the ACT. So what we wanted to do with this new model of care was to get a variety of operations going so we could evaluate them and work out what would work in the longer term for Australia. This is still a relatively new model of care. The ACT government said to us, as we talked to all the governments, that they would like to have support for their nurse-led walk-in clinics. And so here in the ACT, I think there are 5 of the urgent care clinics that are led by nurses. We've promised that we'd open another one in Woden that would be GP-led. But beyond the ACT, the other clinics are led by GPs, with the possible exception from time to time of a couple of the very small clinics in very remote Northern Territory.
Right. Well, so do you accept that, Senator Ruston? Because I know in previous remarks you've been making in recent days, you've kind of shone a light on the absence of GPs, and I got the impression beyond the ACT. Do you say that existing urgent care clinics are not functioning properly because of an absence of GPs?
Well, certainly one of the things that I have been critical about has been the implementation of the urgent care clinics, most particularly because the promise to Australians was that these clinics would be open from 8 a.m. in the morning and 10 p.m. in the evening, and that they would be staffed by GPs. Now, the Minister didn't actually go to say whether there were GPs in these clinics from 8 a.m. to 10 p.m. every day, because I think you'll find if you look at many of the urgent care clinics around the country, that is not the case. But can I just be really, really clear here, Greg? The Coalition supports Australians getting access to affordable primary care, and that includes getting access to bulk billed urgent primary care. And that urgent primary care particularly needs to be targeted to make sure that we're taking pressure off already overrun emergency departments in our hospitals that we are seeing at the moment. They're in absolute crisis, whether it be ramping or people in the emergency departments, bed block in the hospitals. We know our hospitals are in crisis right now.
So you're saying there are no metrics that prove existing urgent care clinics are taking the pressure off EDs?
Well, what I'd like the Minister to actually answer is are all his urgent care clinics open from 8 a.m. until 10 p.m. as was originally promised?
Well, I've been pretty open about the fact that there are some clinics that are taking time to get to that contracted range of hours or span of hours between 8 and 10 p.m. Largely that is due to workforce pressures. And it's very clear in the contracts with those providers that we will work with them over time to expand those hours to ensure that from 8 a.m. to 10 p.m. they are open. To Anne's other point about relief of pressure on hospital emergency departments, where we do have reporting from hospitals where there is an urgent care clinic in their catchment, there is clearly a reduction in the number of semi-urgent, non-urgent presentations going through their EDs, in the Logan Hospital of 10%, in the Ipswich Hospital in the order of 20%.
But does that apply to all locations in Auckland?
Well, some hospitals aren't reporting that data. I'd like to see states and territories report that data in a more definitive way. But when you go to the 1.3 million patients who've gone through the clinics themselves, they say if your kid falls off the skateboard and busts their arm on a Saturday afternoon, the only choice you have really is to go to the hospital ED. There's no GP sitting around waiting on a Saturday afternoon to see your kid. That's why these clinics have been such a game changer for families.
All right, just a quick final one on urgent care clinics, at least from my point of view. And Ruston, one of the government's claims in promising the extra 50 is that 80% of Australians would be within a 20-minute drive of an urgent care clinic when all are built out. Is that a standard that you would hold a Dutton government to with Medicare bulk billing services, whether you call them in an urgent care clinic or not, that they have to be in that range of proximity?
Well, we certainly want to make sure that every Australian, no matter where they live, are getting access to quality healthcare, and that includes bulk billed urgent care. And that's one of the very main reasons why the Regional Australia Future Fund has got a dedicated stream, particularly for healthcare, to make sure that the unique challenges that are faced outside of our metropolitan area are addressed by our health response. It's something that's tremendously important to me. I mean, I live in a regional community. I brought up in a regional community. My mum was actually the sister at the local hospital, and I've seen firsthand the challenges that actually are impacting people in rural and regional areas. And I don't think that if you live outside of our metropolitan areas that your healthcare outcomes should be any different than if you're living in a city.
All right. Now, in just a moment, both of you will have the opportunity to ask each other a question, but without any further ado, we might introduce the colleagues and ask Julie Hare of the Australian Financial Review to step up.
Thank you so much. Will you indulge me with 2 questions, Mr. Jenner?
Okay,
let's
good ones.
Off to a great start.
Okay, so this is for the Minister, but Senator Ruston, I would like your response too. The government's modelling suggests that GPs will earn more than $400,000 under the bulk billing proposal. Doctors dispute this modelling and say they will earn less than that. Is it fair that doctors who are already relatively high income earners get paid more to give Australians free consultations? And my second question, if you will indulge me, is given the problems surrounding Healthscope and its Northern Beaches Hospital in Sydney, do you have concerns about private equity owning critical healthcare infrastructure? So, Minister, if you go first, please, and then...
Well, firstly, on bulk billing, we've used the earnings calculator that is used in general practice to come up with that figure. 2 years ago, a fully bulk billing GP who did 38 hours a week of work, of consults, would have earned $280,000 a year using that calculator, not ours. And that was substantially less, some tens of thousands of dollars less than a GP who was doing an average level of mixed billing, so about 3/4 bulk billed, a quarter charging a gap fee. What the investment that we've announced will mean from the 1st of November is that fully bulk billing GP will earn more than $400,000, which is actually more than someone doing the mixed billing, an average GP doing the average amount of mixed billing. In a rural town, that $400,000 figure is as high as $457,000 because they get higher bulk billing incentives. Now, that is their own earnings calculator. What we have wanted to do is make it very clearly in the interests of general practices to move to this bulk billing model. Not every GP, not every general practice will do it. We've been honest about that. We think that about 3/4 of practices, based on what they are currently doing, would be better off if they shift to our fully bulk billing model. We know exactly what people are currently billing, and we use the earnings calculator used in general practice itself to demonstrate those numbers. But at the end of the day, I can't force GPs to do it. I'm just making the argument it's in their interest to do it, and obviously we firmly believe it's the interests of patients as well. As to your... Do I get another 2 minutes?
Yeah, well, not a full 2 minutes, no. Northern Beaches.
There were clear rules, and Julie's already breached them.
As always, as consistently, as concise as you can.
Yeah, look, I mean, I'm concerned about the viability of private hospitals. That's why I've pulled that group together. It's obviously a pretty variable picture between different owners. And I think we're watching very closely what is happening between Healthscope and their lenders and their landlords, because that could have a very serious impact on some parts of the private hospital market where the Healthscope hospital is strategically very critical. So, you know, I don't want to get into a judgment about ownership. I will say, though, that we are watching very closely what is happening there. We're talking to them and to other operators in the system to ensure that if something goes askew, that patients aren't impacted.
And on Julie's double-barrelled question,
Yeah,
Senator?
well, on the first question in relation to the bulk billing impacts on general practice of the proposal that the Minister's just outlined, I mean, we have to be really careful here that we're talking largely about practices that are currently bulk billing. We've heard from our GPs that many of them don't believe that they will be able to afford to go to a fully bulk billed model and will continue to be charging out-of-pocket costs. But most particularly, I think the thing that we need to be listening to is the real life experience on the ground right now from Australians who are saying that they have never paid more to see their doctor. I mean, just last week I was speaking to a young girl, 18 years old. She just finished her Year 12 last year and just started working. She went to the doctor and she had to pull out $60 out of her pocket. So I think the reality on the ground would suggest a very different situation than and the minister's describing. But in relation to this, we also need to remember that most GP clinics are actually small businesses, like every other small business in this country. 30,000 of them have gone to the wall in the last 3 years, the highest insolvency rates that we have ever seen. So we need to remember that they're paying higher for their energy costs, they're paying higher in insurance, their mortgages or their rents are higher. So they are being impacted by the cost and the inflationary impacts of the cost of doing business in Australia just the same way as every other small business, and we need to recognise that and work together to make sure that we're resolving this so Australians can get access to affordable healthcare. The other, in relation to HealthScope, I mean, obviously we hope for the best with HealthScope, that we are not going to see a problem and see HealthScope exit the market in Australia by whatever means, but we need to be prepared just in case they do. And I'd be very keen to understand what the Minister has been doing for the last 12 months, because it's been quite clear for the last 12 months there were some challenges, particularly around HealthScope. We're talking about 5,000 beds in this country, 12,000 jobs in this country just with HealthScope alone. So I think, you know, the Minister's own private hospital health check could have told him that there was a challenge. In fact, I'm sure that was part of the reason that he did the health check in the first place. So what I would say is that we need to be prepared, and I'd be very interested in what that report that's sitting on his desk behind closed doors is actually doing to deliver on this problem.
All right, just for now, to keep things moving along, I'm going to treat Anne's question as rhetorical. Sarah Ison from The Australian.
Thank you both for your address. I just wanted to ask about dental. Obviously, the Greens have got a push to put dental on Medicare, and as someone who had to get wisdom teeth out for $4 or $5 grand, you can kind of see what they're saying there in the argument. But can I just ask you both, actually, not on all dental on Medicare, but dental for seniors on Medicare, is this something that either of you would look at in your first term or your first term, your second term in government?
Mark Butler.
Okay. Look, I've talked a bit about our response to the Greens policy, and that although Labor has in its platform an ambition to bring dental into Medicare more broadly, we don't have the capacity to do that in the immediate future. We're focused very much on Medicare, strengthening Medicare as it currently stands. As you know, Sarah, when we were last in government, we introduced a Medicare-style funding system for kids from families receiving family tax benefit. That's working terrifically well, except that I think it's underutilised. Only about 40% of eligible kids are utilising it. So I'd like to see that increase. There's available funding for it. There is a recommendation to consider an equivalent style scheme for seniors that would be interesting to look at. Very expensive, but interesting to look at. I guess, you know, that is something for the future. I've just tried to be honest with people in saying our focus on Medicare right now is rebuilding the fundamentals that were designed 40 years ago by Bob Hawke and Neil Blewett, particularly rebuilding general practice. But I think over time it would make sense to bring the mouth into our universal health insurance system. Logically, it doesn't make sense in the longer term to continue to exclude that part of the body.
Senator?
Yeah, well, there's absolutely no doubt the focus right now of the opposition or the coalition is to make sure that we deal with the crisis that is primary care. I mean, all of the statistics that I've provided you today, straight from the national accounts, tell us we have a crisis in primary care, and first and foremost that has to be addressed. But also the other really big piece of this puzzle is making sure that we've got a strong economy, because a strong economy affords us to be able to provide the essential services that Australians need and rely upon. And so I think there is absolutely a fundamental issue to be dealing with the crisis that exists within primary care. That is first and foremost the crisis and the most important objective when it comes to health reform. The second piece of this is making sure that we've got a strong economy, because we have in the past had a strong economy that's allowed us to put new things into the market. I mean, a classic example of that was Peter Dutton's Medical Research Future Fund, that $20 billion that's enabled medical research to be able to provide amazing outcomes for Australians. So a strong economy must underpin this, which will allow us into the future to make sure that we are delivering a health service that Australians want and need.
All right, one more from our working media before we offer you the opportunity for a reciprocal quiz of one another. Stephanie Dalzell from the ABC.
Health Minister, I had a question for you. The Prime Minister stated on social media, this is a quote, "Your Medicare card will be all you'll need to see the GP." Are you suggesting this $8.5 billion pledge will result in 100% bulk billing rates? And if not, are you misleading voters?
No, we've been very clear with our model. We think that we can get to 90% of bulk billing for non-concessional patients. When we tripled the bulk billing incentive, which was a request made by the College of GPs, bulk billing was sliding for concession card holders, so pensioners, concession card holders and kids, as well as for the rest of the community. What the tripling of the bulk billing incentive did was to reverse that slide for concession card holders, and their bulk billing rate is now comfortably over 90% again. But it is continuing to slide for non-concession card holders, 15 million Australians. Our modelling suggests that if GPs take up this offer, those GPs for whom it would be financially beneficial to take up this offer, we can get to 90% for those Australians as well. There will be Australians, and we've been very clear about this, there will be Australians who will continue to be charged a gap fee, but we think we can get to 90% for all Australians under these arrangements.
Well, I mean, I think the reality is the Prime Minister has been out there misleading Australians because right now, as I have expressed in my comments already today, the experience of Australians is a very different experience than the experience that the Prime Minister is projecting. Yes, of course we want Australians to be able to get bulk billed service. Of course we do. We want them to have affordable quality health care. But, and in government, to be perfectly honest, the Coalition managed to get bulk billing rates up to over 88%. So absolutely we are committed to make sure that Australians get access to bulk billed services. But the Prime Minister cannot look down the barrel, look down the camera and tell Australians that what they're experiencing right now isn't real. Everyday Australians know that it has never been harder or more expensive to see a doctor, and no amount of waving around his Medicare card changes the experience that they're feeling on the ground right now.
All right. Well, you two are ordinarily in the Parliament in entirely separate chambers, so you don't often get to pepper one another with questions. And Ruston, why don't you direct to Mark Butler the question you've always wanted to ask?
Oh, I'm not sure I can do that in polite company. But
so many to choose from, I'm sure.
So many, Mark. I could ask him if you like dogs, but I know the answer to that.
Not much.
But look, back on a very serious matter. I mean, right now, Mark, clearly bulk billing is 11% lower than when you came into government, lower than any time during the Coalition's reign. 40 million less bulk billed services last year than when you came into government, and Australians are paying right now the highest amount of out-of-pocket costs that they have ever paid before. These aren't my figures, as I said. These come from the National Accounts and the Australian Institute of Health and Welfare. So when will you recognise that Australians are experiencing a very, very difficult time out there when it comes to access to affordable access to their GP under your time as Minister?
Well, I think I've recognised that from the first day I became Health Minister. The first thing I'd say is that 88% figure the Coalition continues to use has been completely rejected by doctors' groups. The College of GPs said it was misleading and highly skewed. Another GP organisation called it complete garbage because it didn't separate out those things that we're clearly focused on, particularly visits to the GP. I started reporting for the first time bulk billing rates on a quarterly basis for visits to your doctor, for visits to the GP. I've tried to be as transparent as I possibly can be about that. I recognise it's tough, but I also recognise why it's tough, and that is because over the past decade, for much of it, the income for GPs was frozen while their costs continued to climb. Bulk billing is at about 77% for GP visits. That's 77% more than Peter Dutton wanted it to be 10 years ago when he sought to abolish bulk billing altogether. I've been very upfront that there's a crisis in general practice. I've said I think general practice is in the most parlous state it's been for 40 years, which is why so much of our investment over the last 3 budgets has has been focused on that, not just on bulk billing, but delivering the 3 biggest increases to the Medicare rebate in 30 years. The first biggest, the second biggest, and the third biggest. Leaving aside bulk billing incentives, we've increased the Medicare rebate by 3 times as much over our one term of parliament as the coalition did over 9 long years. So I recognise there's a crisis, but unlike Peter Dutton, who created the crisis, we're trying to fix it.
All right, well, there's an answer. Mark Butler, what is it that you would put to Anne Ruston?
Well, to Anne, I'd say, given that Peter Dutton is trying to repeat exactly the same promise he made in 2013 and then betrayed Australians on, why should Australians believe him when he says this time again there'll be no cuts to health?
Well, the first thing I'd say in response to that, Mark, is that I suppose I'm really quite amazed that you were talking about track record in relation to health, because right now every single metric that's before Australians suggests that our health system has only gone backwards under your reign. So I would think that Australians, the one thing Australians really need from their leaders and from their health minister or alternative health minister is actually concentrating and focusing on what's happening right now and providing the answers to the challenges that Australians are facing, the challenges that they can't get into a GP, that they can't afford to get into a GP. So instead of talking about something that didn't happen a decade ago, I think we need to be focusing on what's happening right now and put Australians at the centre of everything we're doing, because quite frankly, I think Australians deserve better than their politicians fighting and lying and scare campaigns. They need us to be focusing on what is really important to them, and that is access to care.
All right, as I said at the beginning, I won't harken back to 2014 too much from my own point of view. I will ask a colleague to step forward in a moment. Just a quick one on staffing and public service as it relates to the Federal Department of Health and Aged Care. Staffing numbers in the budget papers, Anne Ruston, 11,400. That's across the whole portfolio, so including sport. What will the department's contribution be to an overall Dutton government cut of 41,000 public servants, and how long would it take in that particular department to reach whatever that number is through natural attrition and voluntary redundancy?
Well, the one thing that we've been very, very clear about in discussion in relation to the natural attrition policy of the coalition, to make sure that we are focused on delivering frontline services. We have been very clear that no frontline services will be even considered as part of this process.
That's not the whole department, though, that is excised if you apply that filter, is it?
Well, I think the point here that is actually the most salient is that right now, as we've both admitted to, we have a crisis in workforce. It's the biggest crisis, I think, that is facing healthcare at the moment, because without the workforce to be able to deliver the outcomes in healthcare, we cannot possibly deliver them. And so what we want to see is an efficient investment in frontline services. So we've got the doctors trained, we've got the nurses, we've got the allied health workers, we've got the carers, we've got the aged care workers, we've got people working in the NDIS and disability. We need to make sure that we are focused on delivering services to Australians, not public servants sitting behind desks in Canberra, but actually making sure that we are delivering our healthcare system in Australia for the benefit of everyday Australians that need that care and support, which right now, quite frankly, they're not getting.
All right, well, clearly your side, Mark, is not proposing public service cuts, or certainly not in the order of 41,000, but does that mean that the 11,500 in your department remain untouched for 3 years?
Well, let me say to this is a critical point. The coalition has said that national security and frontline services are exempt from the 41,000 job reductions or job cuts. That leaves, on the analysis of the Public Service Commission, a little over 60,000 jobs in the frame for 41,000 jobs going. That includes all of the Department of Health. This is going to be devastating to our capacity to implement health programs. It's no coincidence. This is exactly what's happening through the American DOGE agenda to the Department of Health in the United States right now. We've learned only over the last couple of days that Anne intends to scrap the Centre for Disease Control. You know, again, coincidentally, within 2 weeks of the United States cutting a swathe faith through the US Centre for Disease Control again. But then James Patterson, the spokesperson for the coalition, tried to back away from that. So, I think what we need from Peter Dutton, and in the case of health from Anne, is a very clear statement about what the impact on our delivery of health services is going to be. If the whole of the health department is effectively in scope for 41,000 jobs to go out of a little more than 60,000, what on earth is that going to mean for Australia's healthcare system?
You may not want to leave the CDC element hanging, so maybe you could clear that up for us.
Yeah, look, thank you very much, Greg. And I would make 2 points. One point in relation to this. We're talking about 41,000 additional public servants that have been brought into the public service under the watch of this government. So what we're saying is that we need to have a public service that is forward-focusing, focused on frontline, not people sitting behind desks in Canberra. So we're talking about additional public servants here. In relation to the CDC, I'm disappointed that the Minister is going to perpetuate that lie as well. I have never said what he has accused me of saying. All I would say to you, Minister, is that you made a promise to the Australian public about the formation of a CDC. So far you have failed to make the case for what that CDC might look like. I have not seen any legislation about the establishment of the CDC, and I find it quite interesting that you're suggesting that we import, by the sounds of things, the American-style CDC into Australia when, by all accounts, Australia's response to the COVID pandemic was one of the best in the world, certainly better than cases that currently have a CDC. So my argument is that you haven't made the case for a CDC. So I really respectfully request that you don't make up stories and suggest that I've said otherwise.
All right, thank you both. Caitlin Rintoul from the West Australian.
My question is also on the workforce. There's several regional shires, some that I've reported on in Western Australia, who are forking out millions to lure GPs to their town. It's acute workforce shortages across regional and rural Australia. To you first, Shadow, the Coalition has spoken about slashing migration. Will Coalition cuts impact the workforce? And while there are some crossovers between the levels of government, what is the government doing to assist this issue in the bush?
Well, thank you very much. And 2 points that I would make there. One is that our migration program, as we've been very clear, needs to be absolutely focused on the essential services and the categories of workforce that we currently are struggling to get access to. So whilst we're very keen to welcome a medical workforce from overseas as part of our migration program, which needs to be part of our longer-term solution to the challenges of workforce. So very much making sure that we prioritise those professions that are in demand in Australia, and none could be more important than workforce for healthcare, particularly in the bush. The second thing I would say is that the Regional Australia Future Fund, which is something that the Coalition is absolutely committed to, seeks to actually identify the unique challenges that are faced in rural and regional Australia, and as part of that we have said that there will always be a dedicated health stream as part of that fund that will eventually be brought up to $20 billion out of the $1 billion stream that will be every year directed to make sure that rural and regional Australia is getting the services that I believe they need. That $100 million of that will go towards rural and regional health to make sure that particularly at the moment, that we're growing the strong pipeline of rural and regional workforce. So the first $100 million we have already said we will commit towards an additional 200 Commonwealth supported places specifically dedicated to GPs working in regions and rural generalism, because we know that if you train young people in the bush, they're more likely to stay in the bush. So I think there is a two-pronged attack to deal with this very, very serious issue across the whole of Australia. One is to make sure that we have a targeted migration program focusing on those particular professionals, but we also need to grow our own pipeline of health professionals to support it.
We need more doctors. We've added more than 17,000 doctors to the system in the last 2 years, which is the biggest number in more than a decade. We're seeing GP training turn around from its long-term decline. We're training more junior doctors as GPs this year than we ever have in Australia. Last year was a record exceeded by this year. We want to grow that as well. We're also cutting red tape to allow overseas trained doctors who've always been such an important part of the market in rural Australia to get in more quickly, not to have to pay exorbitant fees to work in Australia where they're coming from comparable markets, places where we have high confidence in the training system. So already you're seeing a big increase in GPs coming in from the UK, Ireland and New Zealand, where we've got expedited pathways for GPs. And that is starting to fill some of the gaps. We've got a lot more to do, there's no question about that. But we have started to turn around the decline in workforce numbers for medical specialties, GP, psychiatry and others, and particularly start to make it much easier for overseas trained doctors to plug some of those gaps while we do what Anne talked about, which is to expand the capacity of locally trained young Australians to become doctors as well.
All right, let's press on. From AAP, Dom Giannini is with us today.
Thanks, both. I just want to know, under a government that you guys are a part of, what will you do to make safe abortions more accessible in rural and regional Australia?
Mark Butler.
Okay. At the end of the day, I've been clear that the operation of hospital-based abortion services is a matter for state and territory governments. And, you know, we obviously share in the funding of those services, but those state and territory governments employ the staff, the specialists in particular, who are able to deliver termination services. They have to make the decision about where those services are available. We've had discussions with all state and territory health ministers about the outcomes of a Senate inquiry into reproductive health to ensure they understand some of the challenges that are being faced in rural communities in particular. It was a good discussion. In New South Wales, for example, I've seen a number of instances where the New South Wales Minister has intervened to plug some of those gaps in access that exist in rural New South Wales. So I think it is something that states are seized of. The responsibility for the Commonwealth is really in more the medical termination area, and we've expanded the availability of MS2 stepped, which is a medical termination, not a surgical termination. That means that over the past 12 months or so, we've seen twice as many GPs prescribing that termination services for the first time, and 3 times as many pharmacists dispensing that medicine. As well, we want to make sure that contraception is more accessible and affordable, that there's more choice for women of childbearing age in that area as well, and we've put very substantial funding, frankly, in an area that was left neglected for 3 decades or more in this country.
Senator.
Well, thank you very much. And the Minister makes a very valid point that the majority of this issue sits within the states and territories, and obviously that is appropriate for them to be making decisions about the hospital services that are provided within those states. But I'd also say that we have been very happy to support and will back in the program of women's health initiatives that have been put forward by the government, because we too believe that Australian women should be able to get access to the quality health services that they deserve and need. But you make a very good point when you actually differentiate between people who live in rural and regional areas. And, you know, as somebody who comes from a rural and regional area, somebody who brought up a child in a rural and regional area, I understand there are unique challenges in rural and regional Australia. And the one thing that we must do better as governments is that we need to understand that a one-size-fits-all dictation from Canberra about how health services are delivered and how Australians are supported in rural and regional areas is something that we need to address. We need to make sure that we understand the unique challenges that are faced by rural and regional Australia. In fact, it's rural, regional and remote Australia, and we should never forget that each and every one of those descriptions is a different thing. Remote Australia is not the same as rural Australia is not the same as regional Australia, and none of them are the same as the metropolitan area. And I think we do need to be more flexible and agile in making sure that we're delivering outcomes for people who live outside of metropolitan areas.
All right.
Thanks.
One of the beauties of the health portfolio is we can ask questions in so many areas. I am mindful, though, of colleagues who are in attendance getting the opportunity to ask there. So we might press on, and I'll come back with a few more. Melissa Code of the Mandarin.
Thank you both for your addresses today. I'd like to come back to this idea of workforce capability and how it shouldn't be an either-or proposition when we talk about frontline staff versus expert bureaucrats. And I'd just like to cite a 2023 capability review of the Department of Health and Aged Care, which said, broad whole-of-system reform initiatives have been limited. In part, this is because, despite strong policy capabilities in particular areas, there is a lack of capability in integrated policy development addressing the interactions between the various parts of the health and aged care systems. The department is not seen to have put forward systemic reform options to government or lead this discussion with the states and other stakeholders. This may be because previous ministers have not asked the department for this advice, and capability in this area may have declined. So my question to you is, with a department of less than 6,000 people, 22% of whose workforce of bureaucrats are located outside Canberra, why does the bureaucratic expertise not matter when a capability review is saying it's critical for the future of system reform?
Senator.
Yeah, look, sure. And I think you're absolutely right around the challenge that you raise around the siloing or the lack of working together of systems. And as I mentioned in my opening remarks, whether that be the public-private partnership that when it works well, works tremendously well, whether that be, our hospitals or our doctors or our nurses or our care workers, whether that be whether you live in the rural areas or whether you live in the city, whether you're talking about physical health or whether you're talking about mental health, we need to actually wrap these all up and actually look at them as delivering services for the good health of Australians, and which is one of the reasons that we are so keen to put investment into primary care, because investment in primary care is actually investment in a healthy nation, and a healthy nation is a happy nation, and a healthy nation also means that we've got a healthy economy. So I think your point is very valid in the sense of we do need to be focusing on a coordinated systems-wide approach to make sure that we're not talking about things in silos, that we actually are focusing on Australians, because at the end of the day, our job, Mark's job, when he's in government, my job when I hopefully get into government, all of our jobs is actually focusing on delivering better outcomes for Australians, and the only way we do that is by the efficient allocation of the resources that are available and making sure they are hitting the ground where they're needed and delivering the outcomes for Australians.
Well, I think those remarks really highlight the risk that is inherent in Peter Dutton's cavalier approach to cutting 41,000 jobs. I mean, the impact on our ability as a country to deliver an effective healthcare system, if you lose those thousands of public servants, hard-working public servants, will be huge. I think at a time when we need to reshape our healthcare system around a very different patient profile to the one that confronted Bob Hawke and Neil Blewett. We're older, we have more complex chronic disease, there's more mental illness in the community. We do need to have a reforming agenda at a Commonwealth level, frankly, no matter who is in government. I commissioned that capability review because the department was shifting from its emergency management focus, which it had shifted to effectively overnight when the COVID pandemic hit under my predecessor, Greg Hunt. And as we terminated the emergency phase of that pandemic, we had to move into what we had as a very ambitious policy agenda, the strengthening Medicare agenda, aged care reform. We want to see over the coming years work done around health technology assessment and many other areas besides. So, I want to see a vibrant Department of Health staffed by people who I know, when I visit them, have a deep commitment to defending one of the best healthcare systems in the world and making sure that it's there for coming years and decades as well. And that's why I'm so opposed to this cavalier approach to cutting 41,000 people from the public service and thinking somehow it's not going to have an impact.
All right, I think we will have an opportunity to get one more from the colleagues. I'll slip one in myself, though, and it's been relayed by an NPC colleague, Megan Brodie of Med News. It relates to the time gap between when a medicine is registered and then when it is funded on the PBS. So I believe the gap is 466 days. In 2024, the average gap between registration and funding for 16 what are called innovative new medicines was 786 days. You're both committed to faster processes in this area, but what is the goal you set between TGA registration and PBS funding? By how much will it shrink? Minister.
Well, it's got to shrink. I think we've been very clear about this. There was a really important review that Greg Hunt Commission, the Health Technology Assessment Review, the first in 30 years. And I supported it at the time as the Shadow Minister because I thought it was timely. And look, that's a complex review with a complex set of recommendations, but at its heart is getting that time frame down and making sure we have a system that is fit for purpose in an environment where there's this turbocharged period of discovery delivering a tsunami of new therapies. They're complex therapies, they're increasingly personalised, they're difficult to assess and approve and then reimburse. So we do need a system that's set up for that, but we need quicker approval processes. Now, there are different views in the review about what that time frame should get down to, whether it's 6 months or 3 months. We've got an implementation group working right now, including through Caretaker, that's chaired by Andrew Wilson, who's worked in this area for a long time, has patient groups, has clinicians, and obviously industry as well, to really narrow that down for the incoming government, whichever it is. And I've said that if we're re-elected, implementing this review is a very serious part of a second-term agenda for health.
And obviously you would be in the same situation, Anne Ruston, awaiting advice if you received that incoming ministerial brief. But do you have an understanding of how much it needs to be reduced by, the time lag?
Well, the reality here is that this review was long overdue. Obviously, COVID put paid to it being started earlier under the previous coalition government. But, you know, we had the review, the findings were brought down last September, and we've seen very little since then. And we've certainly seen no improvement in Australians getting access to life-changing and life-saving medicines in a quicker timeframe. So I think we need to make sure that our health assessment system is as efficient and as effective as it possibly can be. Obviously, we need to make sure first and foremost that anything that is coming into Australia for our patients is safe, and so that is absolutely paramount. But we should be making sure that we have got the most efficient system thereafter. I mean, one of the things that I was absolutely horrified to find out last year is that for the first time ever, there was a cap placed on the number of medicines that were going to be considered by the Pharmaceutical Benefits Advisory Committee, which is the precursor to being considered on the PBS. I mean, we made a very strong commitment in government, which we stand by, that any medicine that has been recommended through the process will be listed on the PBS. However, we've seen for the first time ever a cap being put on the number of medicines that are to be considered. So I think that first and foremost is a very important issue that needs to be resolved. We would certainly never do that. We would make sure that those frontline people-facing services that are the PBS, that are PBAC, that are the MBS, would have the resources to make sure that these medicines are able to be assessed when they are brought forward by the proponent. So I think it is very, very essential that we actually look at the efficiency of this process. Now, it's sitting on the minister's desk. He's obviously having conversations behind closed doors. This is a government that seems to think that non-disclosure agreements are a fundamental part of doing business in government. We certainly don't agree with that. Let's get it out in the open and let's get Australian patients access much quicker to the life-saving and life-changing treatments that I think they deserve.
Understood.
Greg, I've got to respond to that. There is no cap. There was a meeting that had a number of items that they couldn't deal with in one single meeting, and I directed the advisory committee to have a second meeting to make sure they got through the entire agenda. We have listed every recommendation that we've been provided.
Okay. Thank you for clearing that up. Now, having broken all the House rules and asked 2 questions, Julie Hare is back for one more.
Do better, Julie. Do better.
Tight.
Okay, one each. Minister Butler, just coming back to your my earlier question on HealthScope, you said you were talking to other operators about HealthScope. Could you clarify, are you speaking to other hospital groups to step in if HealthScope collapses? And Senator Ruston, you say GP clinics are struggling. Do you accept that many won't take up the government's bulk billing initiative as they can't afford the costs? And if that's the case, why are you matching the policy?
Well,
yes, Mark Butler.
thank you, Greg. Just thought you'd had a micro sleep there. I think it's been covered in the energetic coverage of the Fin Review that there is a vibrant discussion in the private hospital sector about what would happen if HealthScope, the current operations of HealthScope change, in part or in whole. That's not news. You've covered it in your paper a lot. I'll give you one example. When HealthScope withdrew its maternity services in Tasmania, I immediately started a discussion with the Tasmanian government and with Calvary, another operator down there, about ways in which we could fill that gap, because private births for Tasmania is a very significant part of maternity services, about 1 in 3. And we were able to put some money on the table as the Commonwealth and ensure that that gap in the market was filled. So there's no one single discussion. You know, there's a vibrant discussion going on here. Healthscope is the second largest private hospital operator. It's got some hospitals in markets that have a large number of private hospitals, and it's got some hospitals in markets where it's strategically very critical. So, of course, particularly in that second category, we're watching very closely to ensure if a sudden decision is made by an entity that ultimately is owned by an overseas private equity firm and has some pretty vigorous discussions underway with its lenders and its landlords, that of course in the national interest and the patient interest, there's the ability to move quickly.
Thank you. Yeah, well, look, thank you. Of course, we absolutely want to see Australians getting access to bulk billed services, but as you rightly point out, I made the statement that there are a lot of small businesses, including GP services, that are struggling to make ends meet at the moment, which is the reason for my comment. But what we need to do as a government, if we are lucky enough to be elected next weekend, is to make sure that we make the cost of doing business for every small business, every household in Australia, such that they are able to afford to be able to provide these really important affordable services in healthcare to Australians, which is absolutely why we are committed to an investment in primary care, because we understand that unless you invest in primary care, unless you invest in prevention, early intervention, targeted treatments, we have got a health system that is not delivering the best outcomes for Australians, because we believe investing in their health is an investment in their future and the future of this country. So we have to start the investment in primary care, which is why we are absolutely committed to the $9 billion that we have said we will invest in primary care.
Thank you.
All right, well, let me clarify. Far from a micro-sleep, I am in fact enthused and intellectually engaged in this, but time is getting away from us, so we are going to move to closing remarks, and we're reversing the order again by consensus. So, Mark.
Thank you, Greg. Thank you, Anne. Thank you to the questions. This is such an important part of the election campaign, because we generally regard this as a referendum on Medicare, a fought between a party that created Medicare and for over 4 decades has fought to defend it and strengthen it. And we've been doing that over the last 3 years. So us on the one hand, and on the other hand, a party led by a man who was rightly judged by Australia's doctors as the worst health minister in the history of Australia's most important social program. We have worked hard to turn things around after a decade of cuts and neglect. We're delivering more doctors, we're delivering more bulk billing, we've opened urgent care clinics, and we're delivering cheaper medicines. And those have made a meaningful difference to the lives of millions of Australian patients. But we know it's still tough, and we know we need to do more. And that's why it is so important, as people vote in this election, they vote with Medicare in mind. A vote for a party that has defended and strengthened Medicare for 4 decades.
Well, your timing is good, because hundreds of thousands are presently voting already at pre-poll. Anne Ruston.
Thank you very much. Well, this election is quite clearly a choice about Australia's healthcare system. It's a choice between the Labor Party and Anthony Albanese, who is using Medicare as a scare tactic to try and lie his way back into the lodge. A Prime Minister who is actually prepared to lie about something that is as important as Australians' access to healthcare. Or the Coalition, who is genuinely focused on making sure that we put Australians at the centre of Australia's healthcare system. That's making sure that when you want to see a GP, you are able to get to see a GP. And when you get to see that GP, you can afford to see that GP. And we won't forget the people who live in the bush, because we know they face very unique challenges. The health of our nation must always come first. So we're ready to lead, we're ready to build, but most importantly, we're ready to fight for the health of every single Australian. They deserve nothing less from us.
All right, well, there are policy similarities and there are policy differences. I think that much is abundantly clear. You both made your points. We thank you for being here for what presently seems to be the last policy debate head-to-head here at the National Press Club. I will come up in a moment to present you both with your membership cards, but in saying farewell, we'll invite both of you for one final handshake to meet in the middle. Mark Butler and Anne Ruston.